Good evening, everyone. Thank you for joining us for this Enhanced Services webinar. My name is Bill Ennis. I'm an Associate Director with BC Hockey, and this is one of the projects that I work on. It's called Enhanced Services, and the object is to be present in the local associations and offer professional development experiences for their people. We normally do about a dozen or so of these a year. This one is on a pretty important topic, and a topic that keeps changing, keeps getting updated. We learn more all the time, and it was time that we deal with our people again and bring them up to speed on the new information. I'll turn it over to the people that will be presenting this evening. I'd like to introduce you to Brianna Davey. Brianna is our female performance of excellence coordinator and manager. And Brianna, congratulations on the bronze medal at the national championships last week. Good job.
Thank you.
And Brianna also manages the safety and the athlete assistance program. So in saying that, I'll turn it over to Brianna. Actually, Brianna, before I do, I'll just mention a few housekeeping things. First of all, everyone is on mute. If you do have questions, there's a chat box on your sidebar that you can certainly use. And if your question comes after the close of the webinar, certainly you can send it forward to info@bchockey.net, and we'll do our best to get that in the hands of the proper person for a suitable answer. The other thing is that in about a week's time, we record all these, and we'll have it posted after maybe some slight revisions on our website, so that if someone was missing tonight, then we can certainly get that information to them via the website. So in saying that, Brianna?
Thanks, Bill. So on the call today, we have two people. Ann Deach, she is our Hockey Canada Safety Coordinator. She's been with BC Hockey for many years and have seen many different rollovers of different programs throughout BC Hockey. As well, we also have Dr. Shalina Babul. She is the Associate Director and Sport Injury Specialist with the BC Injury Research and Prevention Unit at BC Children's Hospital. She's also a member of our BC Hockey Safety Committee, and she's worked alongside with BC Hockey in integrating the CATT program into our membership, as well as she's developed it right from the bottom up. So thank you both for being on the conference tonight, and I will pass it off to Shalina.
Thank you. Let me see if I can.
Before you get started, just one thing. I wonder if you can go full screen on your document.
All right, hang on. I'm gonna.
Should be in the right-hand corner, upper right-hand corner.
You see that?
Perfect. Okay, now we're ready.
All right, here we go. I'm gonna turn this part off. Hang on. So I've got this. There we go. We'll do that. So thank you very much for having me speak to you guys today. I'm going to talk about what you've just outlined as I'm calling an acute urgent health problem. And I think there's a real need to standardize care by recognizing, educating, and making people aware how to avoid potential long-term consequences of concussions. So what I'm going to do, let's see, hang on. How come I can't go to the next slide here? Oh, there we go. For this presentation, I'm going to just do a quick review on the issue of concussions, show you a clip of something that's happening all the time. Then I'll review the recent Berlin Concussion Consensus meeting and the highlights from that meeting. I want to talk about the new CATT that we'll be launching in about a week and a half. Talk about we did an evaluation of the BC Hockey policy on concussion, so the mandating of the CATT. So I want to highlight the results from that evaluation, and then just highlight Hockey Canada's policy that was just released last week. So watch this clip for a little bit. Hang on, hopefully it's good.
3-1 the final net in overtime. I think they've wrestled another time where Minnick was able to get the best of Lewis. So they've split their matches before. They haven't wrestled this year. Minnick's undefeated, 47-0, a sophomore. Lewis, 39-6, he's a junior. Lewis behind, is he going to be able to get the takedown? He does. Lewis of Harvard scores the first takedown, looking for back points early on in this match. And we're going to stop it. Looks like Minnick's injured.
So right there, you see that the initial hit, he wasn't even moving, and it wasn't recognized initially. The referee's looking, and he finally blew it on the, after the second when he was down and motionless. So now, you guys can hear that okay?
Yep.
Okay, now I'm going to keep playing this. So watch this.
I hope he's okay. He's not moving.
You can see he's motionless.
Finally now they get him onto his back. Boy, he still doesn't look with it, really. No. So he's got 1:40 left of blood time. He stands up to his feet.
So finally, 5 minutes roughly into it, he's finally on his feet, and continue to watch. There's about a minute left.
That's good to see. Talking with the... Oh. Yeah, he's having trouble. I don't know. The trainer just did a balance test on him. He started to wobble a little bit there. We're good to go, though. He's gonna...
And look at that. After seeing that, you've got the announcer saying he's not able to balance on the balance test. It took about 40 seconds of an assessment, and they cleared him to continue to play.
Way to go. And not quite yet, it looks like. Now they'll go out of bounds. 30 seconds to go in the second period. Minnick still doesn't look right. Scramble there by both guys. So I believe it's going to be a 9-3 match. Anthony Lewis of Harvard. And that's going to do it. Anthony Lewis, an impressive match wrestled by him. He's going to be your state champion. 11-3 the final. Anthony Lewis of Harvard, the junior.
So you see right there, it took about 10 minutes after the initial assessment for them to finally call the game. And then Cody, the next day, you can see he tweets here, when you wake up and ask yourself why there's a huge gash on your head, he has no recollection of that match whatsoever. So it's really imperative that concussions are recognized and dealt with immediately. So how a concussion is handled in the minutes, hours, and days after injury can significantly influence the extent of damage and recovery from this injury. If you sustain a concussion and you continue to play, you are 3 times more likely to sustain a second concussion, potentially more severe in nature, and prolonging your recovery. And again, if that second one is not recognized and you continue to play, you're now jeopardizing your life and putting you at risk 9 times more likely to sustain severe brain damage and possibly even death. So it's really, really important to raise the level of awareness and educate all audiences.
A hard blow to your head can cause your brain to strike the inside of your skull. During the impact, your brain squeezes against the inside of your skull, sending shock waves through your brain. These shock waves tear or stretch the axons of some neurons. This trauma is called diffuse axonal injury or axonal shearing. The damaged axons reduce normal brain function by
So I show you this slide because a lot of people don't understand what happens when there's a concussion. I still get people saying, oh, I just thought it was a knock to the skull. Well, it is, but it's what's happening to the brain inside the skull. And more at a cellular level, what's happening to the millions, billions, and trillions of neurons and axons and glial cells to the brain that are sheared and torn. And that's why you don't get the normal processing of information. And it's not until those axons have repaired themselves that those symptoms then go away. So really quickly, just to reemphasize that a concussion is a traumatic brain injury And during that time of impact to the brain, there's a window of vulnerability to the brain, and it really needs physical and cognitive rest to heal for those axons to repair so that you can get back to normal functioning. It's a complex pathophysiologic process induced by trauma to the head or another part of the body that can cause the brain to bounce around inside the skull. It's a structural change, it's a functional change, to the brain that occurs at the cellular level, not so much a structural change unless you have a fracture or a bleed to the brain. I want to highlight you do not have to lose consciousness to sustain or be diagnosed with a concussion, and that only happens in less than 10% of diagnosed concussions. We get a lot of questions, well, my CT was normal, my x-rays were normal. Well, typically, unless you have a skull fracture or bleed to the brain, your imaging will appear normal. There will be nothing seen on those images because it's a functional change to the brain at the cellular level. Your symptoms may appear immediately or subtly after several days later. So it's really important that the individual is watched for a few days to see if any of the symptoms appear subtly. And no two concussions are alike. And everyone reacts differently, and every concussion needs to be treated on a case-by-case basis. Some will recover in the normal course of 2 weeks, others 2 to 4 weeks, and then others even longer. And why that's the case, investigators are still trying to find out. It's a complex yet treatable injury. 85% of concussions will resolve uneventfully. And then you've got about 10 to 15% of the population that will have a longer recovery period. I do want to highlight, though, that when there is a concussion, you should not take Advil or Tylenol immediately within the first few days, because that's going to mask your symptoms. And you don't want to mask, especially the symptoms of headaches, because if your headache progressively gets worse, you want to go to the emergency department immediately. So there's a little bit of confusion around that. So I did want to highlight that in the first couple of days, you should not be taking Tylenol or Advil.
Depending on where your brain is injured, physical symptoms of concussion may include headache, nausea, dizziness, poor muscle coordination, light sensitivity, blurred vision, ringing in the ears, slurred speech, and loss of consciousness. You may have mental and emotional symptoms, including disorientation, confusion, memory loss, inability to focus and concentrate, irritability, and
so I really like this video that I show, because it really highlights the different areas of the brain for which it can be tied to the symptoms. So, you know, a lot of people say, well, I've got this and I don't have this. Well, it's really dependent on what area, side of the brain is affected during that impact. So that just shows you the different areas that are involved in the different symptoms that may appear. So for an on-ice official or for a coach, important things to watch for when an athlete is getting up after an impact is stumbling, eye rubbing, head shaking. Those are telltale signs. And if you are trained, to look at pupillary dilation and or constriction. Other signs to be observed are dizziness, confusion, forgetfulness, again stumbling, slurred speech, whether there was loss of consciousness or mood swings. And it's also important to tell that player or their athlete to recognize and tell someone if there's any nausea or vomiting, headache, balance issues, confusion, blurred vision, feeling sluggish, loss of appetite, to ensure that they tell someone about it. So this is a really challenging and unique injury. I don't know any other injury as challenging as concussions. One, because there's non-specific vagueness of symptoms. We're really treating complexities of a concussion with ambiguity. And what I mean by that is that signs and symptoms mirror other ailments. such as the flu, for instance. Many of the signs of concussion could be also as a result of the flu. So we really have to base diagnosis on the circumstance, previous history, those kinds of things. There's no formal diagnostic criteria for diagnosing a concussion. It's not an exact science. So as I said, X-ray, CT scans will appear normal. There's no blood test to say yes, you have a concussion or no, you don't. And again, we purely base it on symptoms, a few memory balance testing criteria scoring that we do. So it's really not an exact science, but we really heavily rely on patient compliance to management and recovery from this injury. So that's why education and awareness is of utmost priority so that the patient or the individual recovers uneventfully. So we recently had the International Concussion Consensus meeting in Berlin in, well, I say recently, but it's been about a year now, October 2016. And there were some significant changes that came out of that meeting, which changed the way we recognize, diagnose, treat, and manage concussions. So what they did is they identified 11 areas of investigation, and those we call the 11 R's. Recognize, remove, reevaluate, rest, rehabilitation, refer, recovery, return to learn, return to play, reconsider, residual effects, and risk reduction. And I won't go into any of those, but highlight some of the key features out of all of those. So typically, rewind 8 years ago, it was put the person in a dark room and don't let them come out until they're symptom-free. Fast forward or rewind now 4 years, it was do not let the individual go back to activity unless they're fully symptom-free. Now the latest evidence is showing that prolonged rest until symptom-free is no longer recommended, and some form of activity is actually been shown to help in the recovery process. So now we're saying that resting for a maximum of 2 days and then slowly integrating back to activity as tolerated. So find that sweet spot. Stay within the cognitive and physical symptom exacerbation threshold, and what I mean by that is continue your activities, but if you find that those are exacerbating symptoms, then regress back a little bit and slow down and progress a day later. So really slowly progress back to activity. The next highlight is that return to full-time school activities or return to school should precede return to learn, and that wasn't happening before. Parents really wanted their kids back in the hockey game and the soccer game, you know, whatever the sport was, but it's really about getting them back to normal functioning in the school environment and then getting them back into sports. So we really highlighted that at the consensus meeting. A big one was the notion of baseline testing. So coming out of Berlin, we now recognize that the brains of developing children and youth are constantly changing. So we do not recommend doing baseline testing anymore. It's not required or recommended, and primarily because if I did a baseline test on an individual today and I did another one, say, a month from now, those two results could be markedly different based on a number of circumstances such as sleep, hydration, you know, the developing brain. So because of that, we only recommend doing the baseline test or the SCAT-5 at the time of injury to aid in diagnosis. So that's really a big, big thing, because I know a lot of associations, sporting associations, and are having companies come out to do baseline testing. I know in my daughter's hockey association it was there as well, but really the evidence is showing that it's not required at this point. And finally, predictors of slow to recover are really dependent on the number of symptoms and the severity of symptoms at the time of the injury. So if you have an individual with a lot of symptoms that are quite severe, so severe headache, can't sleep, can't eat, you know, sensitivity to light, sensitivity to noise, there's a good chance that individual is going to take a longer time to recover. So they need a really individualized treatment plan, coupled by a multidisciplinary setting of healthcare providers. So whether that's incorporating physio into their treatment plan, occupational therapy, etc. So those are really some of the key highlights that came out of Berlin, which were quite significant. So in saying that, the International Consensus Meeting is really that. It's an international meeting. So in Canada, we have a national concussion advisory group headed by Parachute, which is the National Injury Prevention Organization of the country. And we felt it was imperative to come up with Canadian guidelines on concussion in sport so that sporting associations can take what's identified in these guidelines and really tailor it to their particular sport. So we identified 7 areas that are covered: preseason education, head injury recognition, on-site medical assessment in the office or in the emergency department, concussion management, multidisciplinary concussion care, and return to sport. And for each of those sections, we identify a who and a how. So who are the people that play a key role to implement those recommendations, and how can they do it? And we identify key tools and documents that can be used. So that's, I think there's about 52 national sporting associations and organizations that are tailoring their sport protocols based on this. I mentioned the baseline testing. So we came out with a statement on concussion baseline testing in Canada to essentially say what I just highlighted, that it's not required or recommended at this time and should be only used as an aid at the time of diagnosis. And furthermore, it should only be conducted by a health professional or a medical professional trained in the area of conducting the baseline testing. We were finding that everybody and their dog were conducting baseline testing on players. There were some safety personnel, there were some coaches, there were students and players doing it on themselves, again, with each other. So we really wanted to highlight that only someone trained in conducting the baseline testing or the CATT-5 should be doing the test. So now I just want to talk to you about the concussion awareness training tool that currently exists and what we'll be launching in about a week and a half. So when we built this, we started it in, we started building it 2011. It was launched in 2013, and then the parent player coach in 2014, and then school professional in 2016. And now being, roughly 6 years old, we decided it was time to really give the CATT a fresh look with increased functionality and ease of use for the audience that's using it. So we'll be launching this new site in a week and a half, and as you can see on the left is your home page. And depending on who you are, whether you're a medical professional, a coach, a parent or caregiver, school professional, or participant or player, you can click that. So if I were to click coach, it'll automatically take me to the second page with all the relevant information I need as a coach. So I don't really have to go to the resource section and sift through and figure out what's pertinent to me or what not. This will highlight all the key information that you need as a coach, as well as the course at the very top. The home page over here will highlight the latest news. You can see here it's got the new Berlin Consensus Statement announced. We will be updating the medical professional course and all 3 courses in the next 6 months. So I really wanted to highlight that for you guys. In addition, it's going to have general information on concussion and more specific for medical professionals, broken down into how to recognize, respond, manage, and prevent concussions. Facts and myths will be identified. And then the resource section, we've added this search functionality. So depending on who you are, if you're a medical professional, you'd click that. What am I looking for? I'm looking for clinical tips or on mental health, and it'll automatically sift through and provide you with what you need. So it really gives the user increased functionality to get what they want at the tip of their hands. So another thing we did, as you all know, that BC Hockey had policy for mandating the concussion awareness training tool last September at the start of this season. So roughly under 14,000 on-ice officials were required to take the CATT training before being allowed to be on the ice. And what we wanted to do is we wanted to evaluate this policy to say, did it make a difference, or was it an absolute waste of time? So we did that, and we had just under 1,600 participants complete a survey. 67% of those were male, 50% of those were between the ages of 25 and 44, and 15% of those were between 45 and 64 years of age. One third of those had 2 to 4 years of experience as a hockey official, and another third of those had 5 to 10 years of experience as a hockey official, and 76% of those 1,600 participants had some sort of dealings with concussions. So in terms of the results, this is what we found, that the CATT training led to a significant increase in self-reported concussion knowledge amongst BC Hockey on-ice officials. Those with fewer years of involvement as a hockey official had significantly lower levels of self-reported knowledge before taking the CATT training. 84.7% of respondents reported that the CATT training prepared them to handle a potential concussion situation that was experienced during last year's season appropriately. And the overall satisfaction with the CATT material was very good. The satisfaction score were mostly 4s and 5s, with a small percentage, 10%, that had comments about it. So, whoops, hang on, how do I go back? As you can see here, there's a very high likelihood of them recommending CATT to other individuals. And female officials were significantly more in favor of mandating the CATT training for parents as compared to male officials. So they were in favor of taking this to the next level and making sure that at least one parent or caregiver took the CATT training before the start of the next hockey season. So in conclusion, out of those results, CATT training successfully increased the level of concussion knowledge amongst BC Hockey on-ice officials. A large majority of them felt that the CATT training prepared them to handle a potential concussion situation. Overall, officials reported being in favor of extending the CATT to parents of BC Hockey players, and respondents highlighted the need for clarification on when to begin the return to sport protocol. So our next steps for that are to update the CATT resources to incorporate the 5th concussion consensus statement meeting, which we've done, and that's what we'll be launching. We're going to further explore the value of mandating concussion training for parents or caregivers of players within BC Hockey. And we want to continue to engage in social marketing to raise awareness and knowledge amongst British Columbians on the severity and consequence of concussion. And just to give you an idea, we've had about 35,000 individuals, whether they're parents, coaches, school professionals, or medical professionals. About 35,000 individuals, British Columbians, have completed the CATT training. So we put all this into a one-page infographic that just highlights what I just said. But essentially, we were really pleased that 85% of officials were better prepared to deal with a concussion situation on ice, and that's exactly what we wanted to see. Just to add a few comments that we got, I feel that it is extremely eye-opening and an informative training tool. I had an understanding of what to look for. A quick reference easy access guide would be really helpful, or a quick access checklist. I would like to see parents take the course so they understand the decision of the safety person. And then we wanted to add some negative comments we got, which was, we want more kids to play. Adding more requirements and time commitments is just another barrier to entry regardless of content. And finally, I just wanted to highlight the Hockey Canada policy that just came or was released on Friday. It's very similar, if not almost identical, to what BC Hockey is trying to achieve. And so if a suspected concussion has occurred, the individual is to be removed immediately and not permitted to return that day. If there's any doubt, assume a concussion has occurred. Refer the player to a physician ASAP. If experiencing symptoms, return to play requirements must be met. That's the 6-stage return to play protocol. and written clearance is required by a physician, and all concussions are to be documented and reported accordingly. So thank you for allowing me to speak. I just want to highlight and acknowledge our partners, the BC Ministry of Health, Child Health BC, and BC Children's Hospital. Thank you.
That's great, Shalina. Thank you very much for doing that. I just wonder, Brianna, if Ann Deach has any comments or additions to the material.
Yes, I do. So just for everybody to know, Hockey Canada, or BC Hockey, sent out a memo on the 3rd of November and about Hockey Canada launching the new concussion policy. And it gave you links as to what you should look for. So my recommendation is to go to those links and look at there's a brand new concussion card. We've had one several years, but now there's a new one that helps you. There also is, I like the one that CATT has, but we now also have, it's called Concussion Follow-Up and Communication Form. And it gets you to go through certain stages, and you initial it so that there's a record of what's happening. There is a new app that has come out from Hockey Canada. We had one in the past, but this is an updated one, and it's called Concussion Awareness App. The other one that I think is quite good to look at is they are the EAP, the Emergency Action Plan organization, is updated, and it also has 3 sections. One, the role of the coach, the role of the official, and the role of the Hockey Canada safety person. And in my opinion, all the teams, minor and junior and everything, should have copies of those available in their first aid kits, or at least in a binder, so that they can refer to it. We got comments about that they were looking for paper things like you have on CATT. So that's my recommendation. And the other one is, on the CATT site, they have really good one-page sheets that you can give to a parent. I've done that, given it to a parent so they understand concussions. And the other one they have is very good to, it's for the player themselves, so that they can be more honest in talking about symptoms that they're having for concussion. So my recommendation would be to look at all of the resources available.
Great, thank you very much, Anne. Brianna, any concluding comments?
Just to let everyone know, the safety webpage has been updated. You'll be able to find all the resources for all of the safety programs that we do run. All of the CATT and Hockey Canada policy will be updated within the next week and a half, so that'll be all posted up on our website with the most up-to-date information.
Okay, ladies, thank you very much. We promised all our delegates here that we would be in the range of a half an hour to 45 minutes, and we have succeeded. That was absolutely full of information, so there may be questions that come through. And like I said when we started, those questions will, we would take any question and find the person best suited to find you an answer. So please don't be afraid to ask your question. Simply by email at info@bchockey.net, and someone will get back to you, and we'll do our best to find a suitable resource to answer your inquiry. That's it for tonight. Thank you very much for joining us, and again, thank you, ladies, for a very interesting and informative 35-40 minutes. Very much appreciated. Thanks, everyone.
Thank you.
Have a safe season.